Have you ever wondered if sometimes the most advanced medicine isn't the most effective medicine? This billionaire father spent $1.2 million on 8 world-renowned heart surgeons to save his dying daughter, and every single one of them failed. Contrary to what most people believe, the person who finally saved this 7-year-old girl's life wasn't a Harvard-trained cardiologist with decades of experience. It was a black ICU nurse who understood that sometimes the heart heals best when medicine steps back and love steps forward. I've studied hundreds of cases where expensive medical interventions fail, but this story reveals something that will challenge everything you think you know about healing and the power of human touch. By the end of this story, you'll understand why the most sophisticated surgical techniques couldn't accomplish what gentle care and intuitive wisdom could, and how one nurse's simple approach defied every medical expectation. Keisha Williams went from being dismissed as just a nurse to the woman who achieved what $1.2 million in surgery couldn't, proving that healing sometimes requires stepping away from intervention rather than adding more of it. If you skip this story, you'll miss the moment that shows why love and peace can be more powerful than any medical technology, and how the most profound miracles happen when we trust the body's natural ability to heal itself. The Pediatric Cardiac Intensive Care Unit at Children's Hospital of Philadelphia hummed with the quiet efficiency of life and death medicine. Behind the glass walls of room 347, 7-year-old Lily Montgomery lay connected to more machines than should ever surround a child, each monitor displaying the stubborn reality that money couldn't buy what her heart needed most. Have you ever felt helpless watching someone you love suffer, knowing that all your resources mean nothing against their pain? Richard Montgomery, founder and CEO of Montgomery Technologies, had built an empire worth $8 billion by solving problems that others deemed impossible. But the only problem that truly mattered, saving his daughter's life, seemed beyond the reach of even unlimited wealth. Lily had been born with a rare form of cardiomyopathy that had remained stable throughout her early childhood. But 6 months ago, her condition had begun deteriorating rapidly, her small heart struggling to pump blood through chambers that were becoming increasingly stiff and unresponsive to traditional treatments. Richard had approached his daughter's illness the same way he approached every challenge in his technology empire, by assembling the most impressive team of experts and deploying the most advanced solutions available anywhere in the world. Dr. Elizabeth Chen from Johns Hopkins had been the first specialist, consulted a pediatric cardiac surgeon whose pioneering techniques had saved hundreds of children with complex heart conditions. Her $150,000 consultation and proposed surgical intervention had involved a revolutionary approach to repairing damaged heart muscle. But Lily's body had rejected the procedure, leaving her weaker than before. Dr. Michael Rodriguez from the Mayo Clinic had been brought in next, a heart transplant specialist who had performed more pediatric cardiac transplants than anyone in North America. His $120,000 treatment plan had focused on preparing Lily for a heart transplant, but her rare condition made finding a compatible donor nearly impossible, and her deteriorating health made her increasingly unsuitable for such a major procedure. Dr. Sarah Kim from Stanford had attempted a minimally invasive approach utilizing robotic surgery techniques that had revolutionized adult cardiac care. Her $130,000 intervention had promised to repair Lily's heart through tiny incisions that would minimize trauma, but the precision required had proven impossible to achieve in a heart so small and damaged. Dr. David Thompson from Boston Children's Hospital had focused on treating what he believed was an underlying congenital defect, spending $140,000 on procedures designed to correct structural abnormalities that might be contributing to Lily's declining function. But his surgeries had revealed that her heart's problems were more complex than any structural issue could explain. Dr. Maria Santos from the Cleveland Clinic had brought cutting-edge robotic surgery technology that cost more per hour than most people earned in a year. Her $135,000 treatment protocol had utilized artificial intelligence to guide surgical interventions with unprecedented precision. But even the most advanced technology had failed to address whatever was causing Lily's heart to reject every attempted repair. Dr. James Park from UCLA had proposed experimental stem cell therapy, a $125,000 treatment that involved harvesting Lily's own cells and using them to regenerate damaged heart tissue. The procedure had been scientifically fascinating and theoretically sound, but Lily's body had shown no response to the treatment after months of preparation and intervention. Finally, Dr. Alex Morgan had been flown in from London, an international heart specialist whose experimental protocols had shown promise in European medical centers. His $160,000 treatment plan had involved techniques that weren't even approved in the United States, procedures that required special permits and carried risks that would have been unthinkable under normal circumstances. Each intervention had been performed with the highest level of medical expertise, utilizing technology and techniques that represented the pinnacle of modern cardiac medicine. Each surgeon had brought decades of experience, publications in major medical journals, and success rates that justified their enormous fees. But Lily had responded to none of them. In fact, with each attempted intervention, her condition had worsened. Her heart was becoming less responsive, her energy was declining, and the monitors that surrounded her bed painted an increasingly grim picture of a child whose body was rejecting every attempt to heal it. If you've ever watched someone you love suffer despite the best medical care available, you'll understand Richard's growing desperation. Standing beside his daughter's bed on a cold February evening, listening to the machines that were keeping her alive, Richard felt the helplessness that no amount of wealth or influence could remedy. The medical team had scheduled one final consultation for the following morning, a meeting where 8 of the world's most respected cardiac surgeons would collaborate on a last-ditch surgical intervention that carried a survival rate of less than 30%. Richard stared at his daughter's pale face, framed by blonde hair that had grown thin during months of medical stress, and wondered if he was about to authorize a procedure that would either save her life or end it. The night shift was beginning in the ICU, bringing with it the quiet efficiency of nurses who understood that healing often happened in the spaces between medical interventions when families were left to process their fear, and children were allowed to rest without constant evaluation. Keisha Williams had been working the cardiac ICU for 15 years, and she'd learned to read the signs that indicated when a child's body was fighting the very treatments designed to save them. Keisha Williams had been assigned to the cardiac ICU's night shift for 15 years, long enough to understand that healing rarely followed the timelines that medical textbooks suggested. At 43, she'd developed the kind of intuitive medical wisdom that came from watching hundreds of children navigate the terrifying world of life-threatening illness. How many of us trust our instincts when experts tell us otherwise? Keisha had learned to listen to signals that didn't show up on monitors, the way a child's breathing changed when they felt safe, the subtle shifts in skin color that indicated stress levels, the almost imperceptible relaxation that happened when fear began to subside. Her understanding of pediatric cardiac care had been shaped by personal tragedy in ways that no medical textbook could teach. 10 years earlier, her 9-year-old son Marcus had died from the same type of cardiomyopathy that was now threatening Lily Montgomery's life. But Marcus's death hadn't been the result of failed surgery. It had been the result of no surgery at all. As a single mother working 2 jobs to support her family, Keisha hadn't had access to the kind of specialists who were now rotating through Lily's room with their expensive consultations and experimental procedures. Marcus had been treated at the county hospital, where overworked doctors had done their best with limited resources and outdated equipment. The irony wasn't lost on Keisha that she was now caring for a child whose family had unlimited access to everything that Marcus had been denied. Yet Lily was declining, despite receiving the best medical care that money could buy. Over the 6 months that Lily had been in and out of the cardiac ICU, Keisha had observed a pattern that troubled her deeply. Each time the little girl underwent another surgical intervention, she seemed to emerge not just physically weakened, but emotionally depleted. The bright, curious child who had first been admitted was disappearing, replaced by a withdrawn patient who seemed to expect that every adult interaction would involve pain. Keisha recognized the signs because she'd seen them in Marcus during his final months, the way trauma accumulates when a child's body becomes a battlefield for medical interventions, even well-intentioned ones. During her night shifts, when the parade of specialists had gone home and the unit grew quiet, Keisha had begun noticing things about Lily that the day medical team seemed to miss. The child's heart rate stabilized when the room was peaceful. Her oxygen saturation improved when she wasn't being constantly examined. Most remarkably, her cardiac rhythm showed subtle improvements during the early morning hours when the ICU was calm and her sleep wasn't interrupted by procedures. Keisha had gently mentioned these observations to Dr. Chen during morning rounds, suggesting that Lily might benefit from longer periods of uninterrupted rest between interventions. "I appreciate your concern," Dr. Chen had replied with the kind of polite dismissal that reminded Keisha of her place in the medical hierarchy. "But we're dealing with advanced cardiac pathology here. Her heart needs surgical intervention, not rest." But Keisha's nursing experience had taught her something that surgical training sometimes overlooked, that children's bodies were remarkably resilient when given the right conditions to heal, and remarkably fragile when subjected to constant stress. Her approach to Lily's care had begun with small adjustments that fell within her scope of practice as an ICU nurse. She'd started dimming the lights in Lily's room during evening hours, creating a more natural sleep environment. She'd adjusted the positioning of monitors to reduce the constant visual reminder of medical crisis. Most importantly, she'd begun spending time simply sitting with Lily during the quiet night hours, offering the kind of peaceful presence that allowed a frightened child to feel safe. The results had been subtle but measurable. Lily's sleep patterns improved. Her anxiety levels decreased. Her vital signs showed more stability during Keisha's shifts than they did during the busier day hours when medical teams conducted their rounds and procedures. Comment below if you've ever had someone who just sat with you during a difficult time without trying to fix anything. There's something healing about people who can offer presence without agenda, isn't there? Richard Montgomery had initially barely noticed the night nurse who cared for his daughter. His attention was focused on the impressive credentials and sophisticated treatment plans of the specialists he'd hired, not on the quiet woman who seemed to spend an unusual amount of time in Lily's room during the overnight hours. But as weeks passed, Richard began to notice that Lily seemed calmer and more like herself during the evening hours when Keisha was on duty. The little girl, who had become increasingly withdrawn and fearful during medical procedures, would relax visibly when Keisha entered the room. "Daddy," Lily had whispered one evening while Keisha was adjusting her pillows. "Nurse Keisha makes my heart feel better, not just my body." The comment had struck Richard as significant, though he couldn't articulate why. His daughter had been seen by 8 of the world's most renowned cardiac specialists, but she was telling him that a night nurse was making her heart feel better. Keisha's background as a single mother who had navigated the medical system from the other side gave her insights that her medical training couldn't provide. She understood the fear that came with feeling powerless in the face of illness, the way hope and despair could alternate with each new test result, and the exhaustion that accumulated when every day brought new medical decisions with life or death implications. Mr. Montgomery," Keisha had said during one of their brief evening conversations, "I know you're doing everything possible for Lily, but sometimes a child's heart needs permission to heal more than it needs another intervention." "What do you mean?" Richard had asked, intrigued despite his skepticism about medical advice from someone without an advanced degree. "I mean that hearts are more than just mechanical pumps," Keisha had replied gently. "They respond to stress and peace, to fear and safety, to trauma and love. Lily's heart has been through a lot of trauma in the past 6 months. Maybe it needs some time to recover from the treatments before it can respond to them." The conversation had planted a seed of doubt in Richard's mind about the aggressive treatment schedule that had defined Lily's care. Every specialist had recommended their intervention as urgently necessary. But what if the urgency itself was part of the problem? Keisha had been working in pediatric medicine long enough to understand that some of the most significant healing happened not during dramatic medical interventions, but during the quiet moments when children felt safe enough to let their bodies remember how to be healthy. As the final surgical consultation approached the meeting, where 8 specialists would collaborate on what might be Lily's last chance for survival, Keisha found herself hoping that someone would suggest the one intervention that hadn't been tried, stepping back and giving this little girl's heart the peace it needed to heal itself. The morning of the final surgical consultation arrived with the weight of finality that accompanies last chances. In Conference Room B of the cardiac wing, 8 of the world's most respected heart surgeons sat around a mahogany table, their combined expertise representing centuries of medical training and thousands of successful procedures. What happened next will challenge everything you think you know about healing. Richard Montgomery sat at the head of the table, surrounded by more medical authority than most families could access in a lifetime, listening to a discussion that would determine whether his daughter lived or died. Dr. Chen presented the surgical plan with the confidence that came from having saved hundreds of children with conditions similar to Lily's. The procedure would involve multiple teams working simultaneously to rebuild her heart using the most advanced techniques available in modern medicine. We're proposing a combined approach, Dr. Rodriguez explained, pulling up detailed cardiac imaging on the conference room's large monitor. Dr. Kim's robotic precision, Dr. Thompson's structural repair techniques, and Dr. Santos's regenerative protocols all coordinated under Dr. Foster's reconstruction expertise. The surgical plan was breathtaking in its ambition and terrifying in its complexity. 8 surgeons would work in shifts over 12 hours, utilizing every advanced technique that had failed individually, hoping that their combined expertise might achieve what individual interventions couldn't. "What's the survival rate?" Richard asked, though he dreaded the answer. Given the complexity of her condition and her body's previous responses to intervention, Dr. Park replied carefully, "We're estimating a 30% chance of survival, with significant possibility of complications that could affect her quality of life even if the surgery is successful." This breakthrough moment shows why sometimes the simplest approach is the most powerful. As the medical team discussed surgical logistics and began scheduling the procedure for the following morning, Keisha Williams knocked quietly on the conference room door. "Excuse me," she said, her voice steady despite the intimidating assembly of medical authority, "but I'd like to request a 24-hour delay on the surgery." The room fell silent. 8 world-renowned surgeons stared at the night nurse, who had dared to interrupt their consultation with what seemed like an absurd suggestion. "I'm sorry," Dr. Chen said, her tone suggesting that Keisha had made a significant error in protocol. "But nursing staff don't participate in surgical planning decisions. This is a complex cardiac case that requires—" "I understand that," Keisha interrupted gently, "but I've been observing Lily's responses for months, and I believe her body is telling us something that we're not hearing." Richard found himself leaning forward, remembering his daughter's comment about Keisha making her heart feel better. "What do you mean?" "I mean that Lily's heart function improves when she's not under medical stress," Keisha replied, looking directly at Richard rather than at the skeptical surgeons around the table. "Her cardiac rhythm stabilizes during quiet periods. Her oxygen saturation increases when she feels safe. Her body has been trying to heal itself, but we keep interrupting the process." Dr. Santos laughed with the kind of professional amusement reserved for medical absurdities. "Hearts don't heal themselves. Cardiomyopathy doesn't resolve through feeling safe. This child needs surgical intervention, not nursing philosophy. Wait until you hear what happened next. This is why I share these stories." "Give me 24 hours, Keisha said, her voice calm but determined. "Let me create the optimal healing environment for her heart. No procedures, no interruptions, just peace and the kind of care that supports her body's natural healing mechanisms." The suggestion was so far outside the bounds of conventional cardiac medicine that several surgeons began speaking at once, their voices rising in professional outrage at the idea that a nurse would propose delaying life-saving surgery in favor of unproven alternative approaches. But Richard Montgomery, who had spent 6 months watching his daughter decline despite receiving the best medical care that unlimited wealth could provide, found himself considering an approach that none of his expensive specialists had suggested. "What exactly are you proposing?" he asked Keisha, ignoring the shocked expressions of the surgical team. "Complete stress elimination?" Keisha replied. "Soft lighting, gentle music, minimal medical intervention. I want to place my hands over her heart and use touch therapy techniques that I learned after losing my own son to the same condition. I want to sing to her the way my grandmother sang to me. I want to create an environment where her heart feels safe enough to remember how to heal itself." The medical team erupted in professional protests. Touch therapy wasn't evidence-based medicine. Singing had no cardiac benefits. Hearts didn't respond to emotional interventions. But something in Keisha's voice and her confidence, born from personal loss and professional dedication, made Richard pause. His daughter had spoken about Keisha making her heart feel better. What if there was more truth in that simple statement than in all the complex medical theories that had failed to help her? 24 hours. Richard said, his decision surprising everyone in the room, including himself. "Before we proceed with surgery, I want to see what happens when we try healing instead of fixing." The surgeon's protests filled the conference room, but Richard's mind was made up. For the first time in 6 months, they were going to try an approach that prioritized his daughter's peace over medical intervention. What happened in that 24-hour period would either vindicate the most unconventional healing approach imaginable or confirm that some medical miracles require faith in forces that science couldn't measure or understand. 24 hours later, the cardiac monitors in room 347 displayed readings that made the assembled medical team question everything they thought they understood about pediatric cardiac medicine. Lily Montgomery's heart rhythm had spontaneously corrected itself. Her cardiac function had improved by 40%, and her energy levels had returned to near normal ranges. Keisha's intervention had been beautifully simple. She dimmed the harsh hospital lighting, played soft classical music that helped regulate heart rhythms, and spent hours with her hands gently placed over Lily's heart while humming the lullabies her grandmother had sung to comfort sick children. The touch therapy had been combined with complete elimination of medical stress. No procedures, no interruptions, no constant monitoring that reminded a 7-year-old that she was critically ill. Just peace presence and the kind of love that transcended medical protocol. "This is unprecedented," Dr. Chen admitted, staring at cardiac imaging that showed improvement no surgical intervention had achieved. "Hearts with this type of damage don't spontaneously heal. The scientific literature doesn't support this kind of recovery." "Maybe the scientific literature needs to expand," Keisha replied gently, watching Lily sit up in bed for the first time in weeks, color returning to her cheeks as her heart pumped blood with renewed strength. 6 months later, Lily Montgomery was running through her family's gardens with the boundless energy of a healthy child. Her cardiac function had returned to normal ranges, confounding specialists who had predicted that only surgery could save her life. Keisha had been promoted to Director of Holistic Cardiac Care, a position Richard had created to research and implement the stress reduction protocols that had saved his daughter's life. Major medical centers were beginning to study her methods, documenting the connection between emotional healing and cardiac recovery. Which moment in this story changed how you think about healing? Share your thoughts in the comments, because sometimes the most powerful medicine doesn't come in bottles or operating rooms, but in gentle hands and loving hearts. Keisha Williams proved something every parent needs to remember. The body has an incredible capacity to heal itself when given the right conditions. Sometimes the most advanced medicine is knowing when to step back and let love do what technology cannot. If Keisha and Lily's story touched your heart and you'd like to hear more inspiring stories like this, don't forget to subscribe to the channel and hit the notification bell. Every week I share stories about ordinary people doing extraordinary things. Until next time, remember, healing isn't always about intervention. Sometimes it's about creating space for miracles to happen naturally, with nothing more than gentle hands and an open heart.